Now that you have an idea of just how common STIs are, we are going to take a high-level overview of some of the STIs you will encounter in your work. In this lesson, you will learn to recognize some common STIs. You will also learn to describe the reporting requirements for providers. This slide lists a variety of sexually transmitted infections and infestations, grouped by type of pathogen, or the thing that causes disease. Chlamydia, gonorrhea, syphilis, and chancroid are all caused with bacteria. Bacterial infections are usually curable through antibiotics like doxycycline, azithromycin, ceftriaxone, and penicillin. HIV, HPV, herpes, and hepatitis are viral infections. Viral infections cannot be cured with antibiotics, but they can often be managed with other medications called antivirals. For example, HIV is managed with a group of medications called antiretrovirals. Hep C is an example of a viral infection that can be cured in most people, about 80%, within 8 to 12 weeks of oral therapy. Trichomoniasis is an example of a parasite that can be sexually transmitted. Trich can be cured through the use of antibiotics. Typically, metronidazole or tinidazole will be prescribed. And finally, pubic lice is an example of an insect that can be sexually transmitted. Technically, pubic lice would be considered an infestation, not an infection. Pubic lice can be treated using a lice-killing lotion containing 1% permethrin or a mousse containing perethrins and piperonolbutoxide. Though there are many types of sexually transmitted infections, only 5 are reportable, and these are the infections we will focus on throughout your training. That means that for these 5 infections, healthcare providers are required to submit a communicable disease report to the health department anytime one of these infections are identified. Each of these infections or morbidities has a 3-digit disease code that is used in our surveillance database to track the reported cases. You'll become familiar with these disease codes as you begin working in our database. Arizona is a dual reporting state, so not only is a provider required to submit a report, but the lab that processes a specimen is also required to submit a report. Typically, healthcare providers will report cases to their county health departments, and the labs will report cases to the state health department. Some of the lab reports are received electronically and are automatically uploaded to our statewide surveillance database. Typically, providers and labs that do not have the capacity to report electronically submit reports by fax or mail, and those reports have to be hand-entered into our database. Sometimes patients will have conflicting or discordant test results, where one test is positive and the other is negative. Even if tests are conflicting, both the provider and the lab are required to report the case and all associated test results to the health department so that we can investigate those cases and provide any follow-up that is warranted. We'll explore causes of discordant test results during the syphilis lessons. You can access more information about reporting requirements on our website at azdhs.gov/reporting. This is an example of a communicable disease report that is required to be completed by a provider when a reportable condition is suspected. In the top portion of the CDR, you will find fields for patient demographics, including their name, sex, address, race and ethnicity, date of birth, telephone number, and email address. These values are incredibly helpful when reported because we will use this locating information in our work to connect person exposed to STI to care and treatment. This information is also important for surveillance because we want to make sure we are only counting cases once. If we receive a duplicate report, we can use the patient information to merge those results and prevent duplicate counting. Unfortunately, communicable disease reports are often missing information, particularly for race and ethnicity, reservation, and email, and sometimes providers do not submit a CDR altogether. Under Section 2 to the left, you will find the diagnosis or suspected reportable condition. Since STIs are typically asymptomatic, the onset date is typically missing, and we count cases based on the date of first reactive test. Although there is a space to write in the gender of sex partners, this data is also often missing. At the bottom of this section, you will find the lab results. The lab will tell you what type of test was performed, and you may even get the specimen acquired, which is important for determining site of infection in the case of chlamydia and gonorrhea testing. You will learn more about why sites of infection are important in the next lesson. The top right corner under Section 2 contains additional data points specific to STIs. Again, this section is often incomplete. Providers have the option of reporting whether PID is present for chlamydia and gonorrhea, number of sex partners in the last 2 months, also for chlamydia and gonorrhea, and indicate any symptoms present if syphilis, which is important for prioritizing infectious cases for investigation. This section is also where you will find the treatment information for the case, which is typically missing from laboratory reports. The final section of the CDR contains information in the reporting facility and lab. This information will let you know which clinic offered the screening and treatment. In this lesson, we have identified some common STIs, outlined reporting requirements, and common underreported data. We have shown you why disease reporting is required and where to find the CDR form on our website. Finally, you were also given an overview of how a CDR should be completed, and that common underreported data can contain key information needed for an investigation.